And Dr. Goldstein's biggest point was this study doesn't reflect how real people actually use CBD.
Now, here's your host, Ed Chaney.
Welcome to the CBD Ed Show. I'm your host, Ed Chaney, along with beautiful Kimberly Rose.
Hello, everyone.
This is the best part of our week.
Yes, it is. And it's Friday.
And it's Friday. And I think we do that intentionally, right?
Yes.
Yeah, we're all in good moods. And yeah, it just works out well for the energy of the show. Now, today, there's energy also on our subject. Because our subject, we're always looking for what's behind the message. And today we have a FDA-funded randomized clinical trial that's evaluating cannabidiol, CBD, and liver enzyme levels in healthy adults. Now, it's interesting that this study was done in 2003. Why are we just now talking about it?
Oh, why did I think it was 2023?
2023. I said 2003. Thank you for clarifying. And 2023.
Yeah.
So why are we just talking about it today? Well, because we really didn't have any authoritative review other than the peer reviews, which were not very relevant at all. But we had a doctor chime in, and she exposed some of the components of this study and the relevancy to humans. And that's what we're going to share with you today. It just took somebody, with PhD to kind of reveal some of the issue. Now, here's what we're doing for you today. We're revealing all of that and including ChatGPT AI into the mix so that you have a good base of information that really came from this study that's usable, right? Because if it's just a message, you shouldn't do that. That's not really helpful.
No, it's really not. And I mean, also, I think maybe they did it on humans as opposed to maybe rats way back when.
So again, making it more valid, making that message more valid. Yeah. So FDA's message would be, as you'll see in here, is, hey, be careful using CBD. It could harm you.
Yeah, and it's interesting that they spun it that way.
Yeah.
When in reality, the study shows.
Wait till we get done. There are two sides of this story.
Yeah.
But we're not going to play sides. We're instead going to give relevant information so that you make good, healthy decisions. That's what we're all about. Yeah. And we have the access to be able to provide this for you. Let's get started because we do have a lot to talk about. So we're diving into the concerns around this report and CBD and its effect on your liver. So again, the FDA funded this thing. They mentioned in the study some specific using 201 healthy adults, daily doses of 1,500 milligrams of CBD isolate. Now, that's a particular important piece to consider. A daily dose, 1,500 milligrams, but the second piece of that is a CBD isolate. Now, they did this for a total of 6 weeks, so 1,500 milligrams a day per person, and they did that for 6 weeks.
What? First of all, I'm just going to say that's a lot of CBD.
Well, let's do the math. So 6 weeks is 6 times 7. Do the math is
42.
No, so
48?
Yeah. So anyway, so let's just say we're in that 40 for the easiest of math. Kim, what do you think the cost of 1,500 milligrams of CBD would be?
Even if it's just an isolate, you're gonna be in hundreds of dollars easily.
Yeah. So let's just say that this is about $50 a day per person.
Yeah.
All right. Because that's easy for me to do the math. So $50 a day. We are let's go 50 days on this to keep that math simple.
Right.
Nobody's spending $2,500 on CBD. Not today.
No, definitely not for only 6 weeks. And why?
Nobody's doing that.
You don't need to.
All right. Now, and that's even if my math is correct.
Yeah.
All right. I think so. Anyway. So if that's point number one, and point number two that I want you to consider is the CBD isolate instead of a broad spectrum or a full spectrum. In other words, all the components of the plant. This one, isolate, means that the CBD was pulled from the plant.
Right.
Okay, very good.
Maybe they used an isolate just because they were going to use such a high dose. Again, I don't know why they use such a high dose. It just seems odd.
Yeah, and I appreciate you being the consumer. And I think that's a great position for you today, and I'll stay to the facts.
Yeah.
You like that?
Yeah.
All right, so do I. All right, let's go down this road. All right. The study design, randomized, double-blind, placebo-controlled, compared a high dose of CBD to a placebo. What their outcome was to measure liver enzyme levels. Now, I will take a moment to, a little bit later into the show, explain why enzyme levels should be something of a concern to you. I'll make sure you understand what that is. Now, the two big groups of enzymes were ALT and AST. ALT is alanine aminotransference, and AST is aspartate aminotransference. Now, these are enzymes that signal potential liver stress and damage when they're elevated. Think of them like a check engine light. I like that.
Yeah.
Right? So
Right.
if these get elevated, all of a sudden your liver's like, okay, I'm in a little bit of a stress mode right now.
Yeah.
Okay, most participants had no liver enzyme problems. You
Okay.
did say most. Only 9% in the CBD group had mild elevations. Okay, 9% in the CBD group had mild elevations in liver. These elevations were temporary and resolved without stopping the CBD. Okay, now again, this is directly from the study.
Mm-hmm.
And then finally, no severe liver injury or signs of liver failure were reported among any of them. 1,500 milligrams a day times 6 weeks. Good?
Yeah.
All right. So, no difference in side effects between the CBD and the placebo group. So, no side effects other than what they were looking for with these enzymes. No other side effects were noticed. And no difference in hormonal or cardiovascular markers were noticed also. So, again, I'll say that. So, no differences in hormonal or cardiovascular markers were noticed. Now, again, I think there has been discussions about hormones related to the use of CBD. And again, this is an FDA-funded study that says no,
Yeah.
no cortisol, no estrogen, no testosterone, no effects in your production of these very key hormones.
Okay.
And I did separate that part of the study and asked AI to reflect on it for me. And I got the same thing. Okay, why this matters to CBD users. And I'm just kind of going through this real quick and then we can talk more.
Mm-hmm.
Let's emphasize on the big picture. CBD, a very high dose, is generally well tolerated in people. Most people use far lower doses than what was tested. Again, I don't think anybody is willing to shell out that kind of dough. But you and I have been in this business for 7, 8 years now, and I've never seen it.
I mean,
I don't even give our equine line does not go that high.
it does not for a horse. Yeah, I'm thinking maybe a 200 mil. I'm trying to. I've been sitting here while you're talking and thinking, okay, on a daily basis throughout the whole day.
Yeah. Oh, you mean from
What do I
topical,
take? Yeah.
ingested? Very good. Okay, and that's an interesting observation. Instead of just looking at single dose, like a tincture or a gummy. Yeah, that was very smart. So you probably could get up to 200 then.
I could maybe on a stressful day, or if I am feeling pain from
Okay.
whatever, I might get up to 200, but that's a full spectrum, so that's not even the same.
Well, you'll see in here.
Yeah.
It speaks to that. So how's that cost to you?
What's the cost?
Zero.
200 milligrams.
Zero.
Yeah, well, yeah, for me personally, yes.
Okay.
But
Well, we
somebody
can't talk
else,
about the cost because you have so many variables in there. You
Jeez.
could be doing a gummy, you could be doing topical roll-on soaps, you could be doing tinctures. So yeah, for me to ask you really what that cost was really had no
No.
weight here. You have it all because you have it all.
Right.
All right, let's keep going. So this study helps address fears sparked by older mouse studies or reports taken out of content. So that was nice that that study helped to resolve some of that stuff. But this study used pure CBD isolate, not full spectrum or broad spectrum CBD. That means all the components pulled together. So that all by itself, there is no report, and I'm pretty sure Dr. Bonnie Goldstein will support this. There was when we looked, and I'd say it was AI and myself, we looked and we could not find any relevant studies suggesting that there was an elevation in liver enzymes from the use of full spectrum. Period. There wasn't even a hint of it.
Yeah.
Okay. Let's move over to, hey, let's talk about liver enzymes. I told you about the two, ALT and AST. It was already suggested, consider that as a check engine light.
Yeah.
Now, how does CBD affect liver enzymes? Why is it coming up in a liver study? It's because CBD is processed in the liver. like many medications.
Right. And so an enzyme goes in and what? Breaks it down and filters it. I mean, I know the liver is like your filter.
It is your filter, but for this particular instance, medications and such, it's metabolizing it.
Okay. So
Right?
it does its thing and then it sends it out to the body.
Yes.
Okay.
All right. Clinical trials have found that 5% of this healthy adults that were taking this large amount of daily CBD, had elevated enzymes. We already knew that. Let's see here. Now, it suggested who would be more at risk, and they did find that there were more women in that 6% or that 9% of the group. They found that there was more women. They also found that those using CBD isolate, not CBD, not full spectrum. And then finally, people taking medications that stress their liver, like anti-epileptics.
Right.
And then finally, individuals with pre-existing liver conditions.
Yeah.
Okay, those were a group that were more at risk. Now, here's a bottom line thought coming from my inquirer about what are liver enzymes and how is this study affecting them. And here's the bottom line presented to me by AI. Mild liver enzyme elevations can happen with CBD, especially at higher doses. For most healthy users, it's a reversible sign of stress, not lasting harm. Smart, informed use of CBD, especially full spectrum, low to moderate dose products, is key to not having this issue.
Right.
That came right from an inquiry. Okay, so liver enzymes. Clear? Anything?
Yeah, I mean, I've talked to many customers because, as you age, obviously, a lot of individuals get on prescriptions.
Mm-hmm.
And so I'm always asking do you have a grapefruit warning on any of your prescriptions and that type of situation. But other than, I mean, I don't know. This is so odd because I've been taking CBD on a daily basis since 2017. I get checked out every year.
Yeah.
I even have them check my liver, make sure everything's working out just fine. And I've never, ever had any doctor say, uh-oh,
Your enzymes are elevated.
something's happening. Now, again, I say if I have like a really stressful day or if I've hurt myself at the gym or did too much yard work or whatever it is, and I might get up to 200 milligrams a day, but that's combining like I'll do an oil in the morning. I always do my salve before we go to the gym.
Yeah, yeah.
I might do a little more salve or a little more oil in the afternoon if I'm feeling the anxiety or the pain, and then I'll do either a gummy or an oil before I go to bed. 200 milligrams really still sounds very high for me.
Yeah.
Now they're all full spectrum, so you don't need that much. It's just more powerful CBD.
Yeah, more capable.
Yeah.
More potent even. So again, so just so that we're clear, a full spectrum means that all the cannabinoids in the plant can be present. It really is dependent upon manufacturers like Cannafyl, who will say, I want this cannabinoid, and this cannabinoid present in my distillate, my full spectrum extracted product. But all the cannabinoids can then be present. When you talk about an isolate is extracted, distilled out of the biomass that comes from that plant.
Yeah, it doesn't look anything like a plant.
No,
Like it came from a plant. It's a white powder
Yeah.
and it's not.
We always had a bad taste about that, didn't we?
Yeah.
From the very beginning.
It just
We didn't allow it.
Right. We never connected with it is what
No.
we should say.
Yeah, good point. All right, good point. So there you go. There is some understanding about that study, some outcome of the statistics that came from it, and then some perspectives, both from the study itself and from an AI review.
Yeah.
All right. Now let's jump in and talk about Bonnie Goldstein.
Yeah, this is interesting because I got an email the other day from Project CBD and talking about this study and all of this stuff. And I sent it off to Ed because I was like, this is very interesting. We love Bonnie Goldstein. We've probably followed her, for 3 or 4 years now?
Yeah.
We've did a show on her book. She has a great book out. And she had a thought about this article. I don't know if it was more of an article or the study.
No, it was a study.
Okay.
She responded to the FDA-funded liver study with both critique and clarification.
Great.
Yeah, and that's what we're going to share with you right now.
Yeah. And she is a cannabis doctor.
She is. She is also the author of Cannabis is Medicine.
Yes.
So, yes, she uses cannabis-based therapies, and has notably treated thousands of patients.
Yeah.
with
Again,
these
we love her
therapies.
because she has so much wonderful knowledge about the plant. Most doctors just don't have that knowledge yet, and she does.
Yeah.
Yeah.
Okay, so a little bit of that intro. Widely recognized as one of the country's top physician voices in cannabis science. Now, as she responds to this, the study, remember, gave 1,500 milligrams of CBD isolate daily. It's 4 to 6 weeks. And Dr. Goldstein's biggest point was this study doesn't reflect how real people actually use CBD. So, unfortunately, that's kind of helpful to understand that. It was good in one way that the FDA say, I need to find out where the limits are.
Yeah, let's go
That
to the extreme.
That's it's great for FDA. I think that was a smart move.
Mhm.
But then when the public consumes this information, there needs to be that clarity.
Yeah, I didn't understand why the spin.
Yeah, well,
That
there
it
was a
was,
lot of spinning. And you know
yeah,
what? It could have been, other competing products. There's so many reasons, right?
yeah.
Right? Lobbyists want to jump in because they're getting paid to do it or something like that. All right. And the other one, average consumer doses are normally 25 to 100 milligrams, except for Kim.
Again, on a bad day, I'm saying I might get up to 200, but my average is right around 75.
Well, we had a podcast last week regarding restless leg. I might be jumping up close to that 200 mark too.
Yeah.
All right. Anyway, doing a lot of topical applications lately. All right. Let's keep going. Average consumer doses are 25 to 100 milligrams per day and often full or broad spectrum,
Yeah.
not an isolate. So, why study an unrealistic dose and product type if the goal was to protect consumers? Now, I love that statement. Thank you very much, Dr. Goldstein. FDA funded this. That means they supported it. So in part, she is correct.
Hmm.
Why this unrealistic dose? And FDA is supposed to be in a position for protecting consumers. But the study might have had an alternative agenda, like you and I just spoke. Maybe it was looking for limits.
Yeah, and
Yeah.
that's always good. It's for us to know the limits,
Yeah.
right? It's just like anything, and we talk about this with so many things on this show. If you abuse something, then
Yeah.
it's not going to have the best outcome.
Now we shared with you that full spectrum is so much better. Let's see what Dr. Bonnie Goldstein has to say. She explains that CBD isolate behaves differently than full spectrum CBD. Isolate lacks the balance compounds like other cannabinoids, CBG, CBD, or THC, THCV, terpene, flavonoids, found normally in full and broad spectrum products.
Mhm.
Higher doses of isolates may have a different metabolic burden. I like that. Sounds better than what we normally say.
Yeah.
It's just better.
Well, and we've covered this in a study, right?
Yeah.
Or in a show before
We certainly
where you need to use more isolate than you do full spectrum. There's no bell curve, or what was that curve? There was a curve that we talked about way back when.
Yeah, so it is the oh, so you're making
Oh,
me
now
forget right now.
we're on the spot here.
Yes, but a full spectrum does offer a bell curve. It's very potent, but it doesn't get potent by the more you use it.
Yeah,
It peaks and then it doesn't matter how much you use.
right.
All right. So, and they base it off of the synergistic relationship of all those materials Dr. Bonnie Goldstein was talking about, the other cannabinoids, the terpenes, the flavonoids. That synergistic relationship between all of those had the impact that the body knew what to do with. The isolated product, the body likely is just not designed to process that.
Right. It wants the whole shebang,
Yeah.
not just the one guy.
Okay, so, and as we keep going on this, plus very few people take CBD isolate in any clinical setting. Now, this comes from a physician. Now, you
Yeah.
and I may not always be aware of that, but I'm quite sure she is. And she urges researchers and regulators to study real world dosing and products instead of worst case scenarios. I absolutely love that request. That's perfect.
Yeah. I
Now
mean,
that you've done that, let's go down to real world cases.
yeah, let's talk about the real, right, the real stuff. I mean, we all know what the world does now and what the world wants now is the drama.
Sure. Yeah.
But in real world, there's no drama. There's no drama here.
Let's keep talking as she goes on about the liver enzymes. Key distinction: elevated liver enzymes don't automatically mean liver damage. Dr. Goldstein emphasizes that minor ALT elevations are often transient and clinically insignificant. Remember, she's reviewing the study, so she knew the levels of increase.
Mhm.
She compares it to a speed bump, not a red light. She also calls the lack of clinical symptoms or evidence of liver disease in the study. Even in those with elevated enzymes, already there was a lack of those symptoms or evidence of liver disease.
Do you think maybe, but
Now that could be a scare tactic then.
yeah.
Yeah.
Do you think FDA is doing this because possibly they're going to get ready to say, okay, we can release this as a daily supplement?
Well, we already know the path has already started.
Yeah.
Whether they're going to call it a daily supplement, I mean, a dietary supplement, still don't know yet.
Yeah.
But the path is already created.
Mhm.
It's already started. And I know a lot of manufacturers are already gearing up. How about a takeaway from the CBD community? So, Dr. Goldstein's message: this study doesn't mean low dose CBD is dangerous. It does show the need for better studies using actual consumer behaviors. And elevation in liver enzymes should be interpreted in context and not used to spark fear.
The drama.
Right? Now, we believe in responsible use of science-backed information. That has always been our very sound platform from which we operate.
It is our foundation, yes.
Absolutely. So we also believe the consumer deserves better research than that really mirrors the actual use of CBD products that people are actually doing out there.
Right.
Yeah. All right.
Right. But again, we've talked about this again over and over. I don't know if it's Americans or just humans. Some people like to go above and beyond.
I absolutely agree.
That feels so good. I'm gonna take more.
And I thought about that, and I even wanted to say it was so unrealistic, but who's going to spend $2,000 a day on, or $2,000 a week or whatever on CBD? I'm thinking, oh wait, maybe there are some people out there that would do that.
Right? Because I think there's a little bit of a chatter going on with the amount of supplements that people are taking. Like there's, I mean,
True.
you know what I mean? Supplements are they're good for you, but always taking too many supplements can have a problem and I think that's why maybe females, because we are probably more susceptible to the glamour that a supplement is provided to the world, right? Oh, that's going to do that for me. I'm going to take that. And I am like right there with all the other females. I have consumed collagen, all the things I have. Now, have I gone back to just my one CBD supplement? Yes. And some vitamin D. Other than that, I'm just not going to be.
So it sounds like you can go for the ride and then flush your system out.
Yeah, I mean, I'll take a supplement for, I give it a good 60 days. I try and give it 60, 90 days. And then I'm like, you know what? That's not really doing anything. So I'm done.
Well, I would like to say that both Kim and I, with all the knowledge that we've gained, over 200 podcasts and all the relevant research that went into them, running a CBD manufacturing brand, that we would both wholeheartedly agree that you do not need, based on all this information, worry about any liver damage from any daily doses that are common to today's population.
Yeah. Yeah. I think, again, it's just like anything. If you drink a beer a day, okay. If you're drinking, 5 gallons of vodka or something, you're going to have a problem.
You can tell it's Friday. Kids already talking about booze. Okay. All right. Hey, how about a balanced look from our different AI, artificial intelligence sources? Okay. So again, we've amassed a couple of them. We're trying to actually build one that is tailored to us going out and reviewing studies and analyzing data from an intelligent perspective, not from a hidden agenda place.
Right.
Okay.
Yeah.
So this will become part of our show from here going forward, anytime we're reviewing data.
You're going to have a little question and answer from ChatGPT?
From our AI model. Oh, correct. Okay. Yes. Yeah. So we're going to break this one down today. So the perspective setup, AI trained on medical literature and current research. So here's how they're going to weigh in on the enzyme study along with Dr. Bonnie Goldstein's critique. And they're going to, and of course, without bias or hype. Okay, so AI will likely acknowledge the study was well structured, randomized, placebo-controlled, and FDA-funded. Good science. All right, they're acknowledging that. But the dose was extremely high, 1,500 milligrams CBD isolate daily. Observations. That's like studying the safety of drinking 15 cups of espresso a day to inform regular coffee drinkers.
Didn't I just say that?
I know. Hey, this is hard on you.
Use, not coffee, but anywho.
Right. But not reflective of an average consumer who's drinking what? I know people freak out at 3 cups, right?
Well, I mean, I'm a 1 cup girl. I can't go
Right,
past it.
right. Okay. Okay. How about practicality meets clinical experience? Dr. Goldstein adds important real world clinical context, something studies often lack. Her challenge isn't to the science itself. You know me, I love a lot of words around here.
Yes.
The study shows CBD isolate at a very high dose doesn't really cause serious harm to the liver. Dr. Goldstein reminds us not to generalize extreme case results to a typical consumer using 25 to 100 milligrams of full or broad spectrum of CBD. Here is an observation where the truth likely lies. Again, coming from our AI model. CBD is not liver toxic at normal doses in healthy adults based on this and other researches. Because, by the way, I do have it go out and include not just this, but any other relevant researches.
Yeah.
Liver enzyme elevation, when they happen, are mild, rare, and usually resolved on their own. And then finally, we still need more studies on realistic doses, formulations, and long-term use, especially in people with liver conditions or polypharmacy. So, final thoughts. The intelligent takeaway. Let's use studies like this to guide safe usage, not to create fear headlines. CBD is generally safe, but like anything, should be used with mindfulness, especially with other medications or health conditions. And we can be more specific for you of when they talk about, especially with other medications, using it with other medications. Remember, enzymes that can metabolize some of those medications are also affected by CBD. They're increasing or, they're regulating them. So they can increase them or decrease them, which means it can alter the amount of medication you actually end up with.
Right.
After it's been metabolized.
Yeah.
That's the big concern between AI's statement here of should be used with mindfulness, especially with other medications, right? And by the way, we'll just share with you, it's the grapefruit warning medications.
Right.
Because they are metabolized by the same enzyme that is impacted by the ECS system. Notably, CBD has an impact on it.
Yeah.
On the modulation of that enzyme production. Okay, final thoughts. Wrap up. At the end of the day, neither the study nor Dr. Goldstein is wrong. They're just looking through different lenses. And in the spaces between lab data and clinical experience, that's where the smart CBD use lives. I'm thinking that was pretty intelligent from our AI model. Again, so keep in mind, went through as many resources as, well, I can't say that. They went through all resources that were available online. Why? Because they can, and they can do it in seconds. Me, I'm moaning and complaining because it takes me hours to research a single item. So
yeah, and this is why I send you all this information so that
Right.
you can do that work. And thankfully you have an AI pal now, and you can go through things quicker and pull out the nonsense. That's really what it does, right? It gets rid of the nonsense.
Well, exactly. So I think specifically, let's call it out. It is a intelligent look, and not one with a message behind it.
Right.
I know that there was a specific statement in here I wanted to come back to, but I can't grab it real quick.
Yeah.
Here's what we get to offer you as we advance our own AI model is we are teaching it. So that means we are learning how to ask the questions that are relevant to you, the user of CBD products.
Right.
And so when I do research, I don't have to waste all the time going through things that aren't relevant.
Right.
I can just have it consume all that information for me and spit out what I need. The unique thing about AI is it could go through 100 studies in a second. For me to review 100 studies, I'm all weekend. It's an all weekend project.
Yeah, and then there you are with, and I've seen it, like 500 sheets of paper all over the place. There's yellow highlighter over here, orange over here. It is a mess. And so this is a nice and easy way. We are learning how. He is much more proficient at AI conversations than I am. I'm learning.
Yes, you are. Absolutely.
I'm learning. But it's a great tool.
Yeah.
to help us get it into layman's terms for you guys, so we're not reading studies from, the actual study and then we destroyed the English language.
Oh, of course. Yeah, you can always expect that one from me. I'm surprised I only slaughtered 1 or 2 words.
But I'm actually going to say it's a good idea that FDA did this. We're going to say it. First of all, we're so thrilled that it's
Human
a study
study.
on humans.
Yeah, and FDA funded.
Right?
Wonderful, right?
Yes.
So there was no argument. They said this was good science.
Yeah.
Yeah. It was Bonnie Goldstein that pointed out, I'm not saying it's not good science. It's not relevant. It's not useful. It's not helpful.
Yeah.
How about we get something out there? I was done in 2003.
Right.
I mean, 2023. I did that again. How come there is not another one? Why didn't they take it to the next step?
So I think one of the things I saw was maybe Epidiolex, which is a CBD isolate.
Yes.
And those children or individuals that are using Epidiolex for seizure control, maybe are taking higher doses.
You know what? That's a very, very relevant observation.
And that's an FDA approved product.
It's the only FDA approved product.
So I'm sure they probably needed to do a little CYA and maybe, that's the only thing I could think of was, I think Epidiolex is fairly high doses.
Yeah.
For seizure control.
I think I'll look that number up for you. Okay, so let me just wrap today's show up. If you received information about this study in 2023 about increased levels of enzyme in the liver because of CBD use, you now have a perspective from FDA, Dr. Bonnie Goldstein, and us on the CBD Ed Show on what we believe is relevant information for you literally to take home. And that is, if you are taking doses under 100 milligrams, and it's not a CBD isolate, this is not an issue for you.
Right.
Unless you already have elevated enzymes, or unless you are currently taking medications with a grapefruit warning on it.
Mm-hmm.
Okay?
Yes.
And by the way, always feel free to send your questions to us. We always love it answering these questions. We do all this work and we do it for you. So we love the audience, and feel free. If you have a question about medication or something in this discussion about these studies, please send us an email at let's do it at team@cannafyl.com.
Team, TEAM @cannafyl.com. That comes directly to me, and Ed and I go over all the questions and answer them as thoroughly as possible.
Yep. And if anybody wants access to Bonnie Goldstein's book, give us also send us a request and we'll send you the link. Okay.
Yeah.
All right. Well, we enjoy doing this show. We really appreciate you listening and following us. Thank you very much. And hey, here's continuing down the road of your body can heal itself.
Yes, it can.
And we're going to help. Okay. Over now. Bye.
Bye now.